Hi, I'm Dr. Dana Ciani. I'm an optometrist at Buck's Eye Specialist, and I'm going to be talking about the different causes of dry eyes and a new treatment that we have available in the office. People who experience dry eye symptoms have a variety of complaints, whether it be redness, tearing, burning, grittiness, fluctuating, or blurred vision, to name a few things. Many patients think their dry eye symptoms are due to decreased tear production, but in reality, it's a pretty small portion of patients who actually have tear insufficiency, maybe 15 to 20%. The majority of dry eye patients have their symptoms from Meibomian gland disease or evaporative dry eye. This slide gives us kind of an anatomy or a breakdown of the tear film. There's an inner mucin layer, middle aqueous layer, and then outer lipid layer. Meibomian gland disease, or MGD as we affectionately call it, is when the meibomian glands, which line the upper and the lower eyelids, do not produce or excrete the oils that are needed to nourish the outer lipid layer. This exposes the inner water layer, which can evaporate, exposing the cornea and causing discomfort. MGD is extremely common and is caused by chronic blockage or inflammation of the meibomian glands. Over time, this can lead to change of structure, which can ultimately lead to gland atrophy and permanent loss of function. Traditional methods to treat MGD, which we still recommend to patients, include hot compresses and lid massage to loosen up and express the oil blockages. Not only is it difficult to maintain the amount of heat needed to be effective, but the source of the heat is external, so it has to travel through the entire eyelid, including the tarsal plate, which is a dense connective tissue that sits in the eyelid, protecting the eye itself. We're excited to have the LipiFlow dry eye treatment machine in our office, which is the only FDA-cleared medical device to treat Meibomian gland disease and restore gland function. What's exciting about the LipiFlow treatment machine is that the eyepiece applicator actually sits between the eye and the eyelid itself, so it's right against the Meibomian glands, making the treatment that much more effective. It's a 12-minute painless procedure which involves heat and gentle massage to loosen up the oil blockages and essentially reset the Meibomian glands to make them as efficient as possible. What's also exciting about the LipiFlow treatment is that with proper maintenance, it can give patients symptomatic relief for 1 to 3 years, where similar heat-type procedures may last just months. In addition to the LipiFlow, we also have the LipiScan, which is a diagnostic test we do free in office to determine if patients have Meibomian gland disease and if LipiFlow would be an appropriate treatment for them. Here are a few scans for you to kind of see what we look at when we do a LipiScan. This first scan is a patient with healthy Meibomian glands, and as you can see, the glands themselves extend the length of the eyelid, and there are not any areas of dilation towards the opening of the gland, which we know can indicate chronic obstruction. This next patient has what I would call moderate Meibomian gland disease, and as you can see, there's quite a few glands that are shortened or truncated, and there's some dilation towards the opening of a few of these glands as well. And this patient is actually me. I wanted to show this because even though I do not have symptomatic dry eye, I still chose to have the LipiFlow procedure done because I know the path that this can take. Meibomian gland disease, dry eye disease are chronic progressive conditions. And at some point I would become symptomatic, so I chose to intervene at an earlier stage. The takeaway from this is that the LipiFlow can be helpful for any stage of Meibomian gland disease, whether it be to relieve the symptomatic patient or to prevent symptoms in the asymptomatic patient. If you think you may have dry eyes, we'd love to have you come in for a full dry eye evaluation where we can discuss all the treatment options available and determine if LipiFlow may be helpful for you. Click or call today to schedule an evaluation.